We are pleased that you have chosen to have your joint replacement surgery at Southern Maine Healthcare. This short video provides you with a brief outline of what you can expect once you enter our care. On the day of your surgery, please come to the reception desk in the main lobby of the hospital. A volunteer will escort you to the Ambulatory Care Unit, or ACU, where you will check in. A nurse will take you into the pre-op area. Don't forget to bring your joint replacement binder, as it contains important information about what to expect in the days following surgery. Your pre-op nurse will provide a Johnny to change into and a bag to hold your personal items. After you have gotten into bed, you will be admitted and given a bracelet to wear. The nurse will check your chart for pre-admission testing results, review your list of medications, and start your IV. You will also be visited by members of the surgical team, including the surgeon who will mark the leg or shoulder being operated on, the anesthesia provider who will set up any required pain blocks and answer questions about the anesthesia and pain management, and the operating room nurse who will care for you during surgery. In keeping with our patient safety standards, you can expect each caregiver to clean their hands, introduce themselves, and ask you to verify your name and birth date. When you are taken to the operating room, anyone who has accompanied you will be directed to the waiting area, where your doctor will meet with them after the surgery is over. The operating room can be cool, so if you feel chilly, please let someone know, and warm blankets will be provided. After surgery, you will be moved to recovery, where you will wake up. The nurses in recovery will monitor your vital signs and pain level to make certain you are comfortable before being taken to your room. In order to ensure adequate healing and recovery, you will be encouraged to take pain medication so you can comfortably rest and move. For knee and shoulder joint replacements, a cryo cuff will also be applied for pain control. Once you are in your room, you will be encouraged to drink plenty of fluids until you are ready to resume eating a normal diet. Pain is to be expected after surgery, and we will ask about your comfort level frequently. When pain begins, report it to your nurse and take pain medication before walking and other physical activities so you can move more comfortably.
We encourage patients to ask for pain medication if they need it. This is not a situation where we want people to be laying there trying to hold out as long as they can before asking for medication. It's much easier to control the pain if we catch it early before things escalate. And some of the medicines that we have ordered are written as needed medicines. They're not automatically given, so the patient has to be actively involved in this process.
Southern Maine Healthcare joint replacement is joint certified at both campuses, both the Sanford and the Biddeford campus, which is an extensive certification. That entails that you have extraordinarily low complication rates and infection rates. Everybody goes through a rigorous process to be part of the joint team, and this is definitely a team approach. It's not just myself as your surgeon, it's everybody who's in the team that is very, very well trained for joint replacement.
Joint replacement patients typically stay in the hospital between 2 and 4 days. During this time, our physical and occupational therapy team will work with you using exercises and activities designed to get you up, moving, and back to normal as quickly as possible.
The physical therapist will come in and we will generally get you out of bed on the first day after the procedure. They will be up, and depending on how well they do with pain control and their vital signs, they will either just walk around the room or potentially take a walk out into the hallway. On the second day after the procedure, it's the same process. You'll be visited by the orthopedic team early in the morning. We'll come through, assess how you're doing again, and progress your mobilization with the physical therapist. If you're doing well on day 2, a lot of people will be walking in the hallway, and they'll be taught how to do stairs, and they will be given all their discharge instructions so that they know and can feel comfortable going home.
A case manager will also coordinate with you, your family, and the therapists to prepare you for discharge home or to a rehabilitation facility.
There's a tremendous amount of things that we can do prior to joint replacement surgery. The decision to have a joint replacement is ultimately the patient's decision. It's when you're not able to do the things you want and need to do to have a fun, functional lifestyle. I tell my patients that I never tell them that you need one now. They tell me when they want one.
Unlike other surgeries where there's a window of opportunity where you have to fix something, you sort of have the option, if you want, to live with arthritis for quite a while. And it's really individual when it's up to you to say, this isn't acceptable for me anymore. I need a better quality of my life. And the nice thing is that pretty predictably, joint replacements do offer a big improvement in your quality of life. So the day-to-day pain that people experience, for the most part, goes away. The limitations that some people get used to also, for the most part, go away. So they start to be able to take on activities, even simple things, particularly with shoulders, reaching for high shelves, sleeping on their sides, which they couldn't do without thinking about it or without being in pain previously.
Some of the most commonly asked questions by patients before and immediately after surgery are when they can return to various activities, including their employment or recreational activities, golfing, wherever their interests lie. My answer to returning to work is a lot of that depends on what the person does for their job and also their speed of recovery.
I often see people in my office about 4 weeks after surgery, and they will tell me that they're better than they were before. So it doesn't mean that that's as good as they're going to get at that 4-week mark. They may still make improvements and continue their therapy for even 2 to 3 months after surgery. But within that first few weeks, there's already been the crossover from the post-operative discomfort to the point of already being better than they were before.
I get great feedback from patients about their experience with their hospitalization here. And they always say from the beginning of their hospitalization all the way through their discharge, they were pleasantly surprised by how easy it was, how caring people were. And I think it's a very personal, warm experience that's not intimidating and feels as non-medical as it can be.
We have an excellent staff. They're very familiar with this procedure, so people move through it very comfortably. I think if you look at our numbers, we perform very well compared to anybody in the state or nationally. And I would feel comfortable having my parents come here to have their joint replaced. And I know a lot of people that have been through it return because of the experience that they've had, if they need to have another joint or if they have a friend or family member.
I think someone should choose SMHC for their joint replacement because you will be with your local doctors in your local hospital with a personalized, individualized approach to your care.
Thank you for choosing us for your joint replacement surgery. We are committed to providing care with excellence always and hope the experience exceeds your expectations.